This is NUTRIS, the Nutritional Understanding and Treatment Recommendation Intelligence System. This was developed by Pratik, Nikhil, and me, Aman. So this is our problem statement. We aimed to combat the problem of malnutrition using CASP. Malnutrition has two key forms, undernutrition and overnutrition. Undernutrition consists of wasting, stunting, and being underweight. Overnutrition consists of obesity. So our project focuses on providing an assistance tool for combating undernutrition. Now, why is this so important, right? Every country in the world is affected by one or more forms of malnutrition. See, this affects women, infants, children, and adolescents, with poverty and poor sanitization amplifying the risks. In fact, in 2022, 231 million children under 5 were estimated to have some form of malnutrition, and nearly half the deaths occurred under children 5 years of age. And this was also linked to undernutrition, and these occurred mostly in like low and middle income countries. And this is a big problem because it starts with individuals and their families, but then it slowly expands to their communities, and as a result, affects the countries as a whole. So in designing a program to solve this problem, we decided to take in some key inputs, such as your demographics, your anthropometric measures, socioeconomic factors, whether you have morbidity or illness, lifestyle factors, your diet intake, and medical reports. We use official sources and reports for facts to base our rules off for the logical program. One thing we used was the BMI indicator to determine nutrition status. We encountered some challenges, as to be expected from learning a brand new language. We had to find the right source and reference for facts and rules. And we did this using official government reports, and we had to understand the Prolog syntax and the properties of the language. Luckily, though, we were also able to accomplish some very great things. We were able to modularize the program and get it working really well. We were able to create a working program, importantly, to detect the signs and symptoms of malnutrition in children and other patients. This program also has a lot more factors than we planned initially, such as implementing government policies and more. Now I will go into a demo before I get to the rest of the presentation. So this is our program here. It takes in key parameters as mentioned, which include age, weight, and height. It validates the inputs, right? And of those age categories, we break it off into 3 specific categories: children under 6 months, children 6 months to 2 years, and 2 to 15 years. This is because symptoms vary, especially in those ranges. From there, we have BMI classification, feeding, follow-up schedules, sanitization, and the calorie multipliers based on the level of malnutrition. We also have treatment plans and policy recommendations. We also have an explanation here that sort of like explains what is being done. Finally, this is our main predicate. We validate the inputs, grab the parameters from each category, and we output them. So here we have some tests, which I'll run for different age ranges. If I click run, we have 8 test cases, starting with 1, just a brief overview. You can see the parameters that are input. We categorize them as severe. We provide a treatment plan, some feeding recommendations, protein-rich foods, and a schedule. We also have policy recommendations as well, and sanitization recommendations. However, if we move up to like a different case, right? Like case 8, for example, we have larger age. We also have a category, treatment plan, right? Follow-up schedule, but the sanitization here is good. So we have no sanitization recommendations. And we have policy recommendations too. So it varies for like different ages within that range and different levels. Like for example, this child has moderate malnutrition, good breastfeeding, good diet, good sanitization. So that's how our program works. Now back to what we learned, right? We learned a bit more about CASP by handling facts and rules. We were able to learn more knowledge as well, and we learned how to validate the data. In the future, we plan on integrating a chatbot into our solution, expanding the scope of the solution, and customizing the tool based on regional factors. This is our appendix, which contains sources from official reports and the Stanford Center for Health. Thank you for listening.